Hi, welcome back to Chinese Medicine Podcast. I'm Marie Hopkinson, and I'm sure if you're this far along in the episodes, you probably know who I am. I don't need to introduce myself. So today we're going to be talking about the kidney and the water element in Chinese medicine. This is a series for students, people on their journey. Maybe you have already started studying Chinese medicine, or you're just getting into it, or maybe you've finished and you just want a refresher, or you just like listening to my voice. So what we're doing is we're using Giovanni's Maciocha's book to go through the main functions of these organs. So we've done the ones so far up to water, wood, fire, earth, metal. I think I changed the order around for some reason. I think I lost one of the videos and had to put the metal before the earth. But anyway, here we are. So what we're going to talk about today is I'm just using this as a guide to go through the general headings that you probably would go through in your TCM studies. So the kidneys, I'm just going to go through a couple little points here. And what we're talking about is traditional Chinese medicine, so TCM. Now, sometimes you hear me talk about classical Chinese medicine, which is a little bit of a difference. And this is one of the organs, or the organ systems, where there's a big difference between how it would be seen and where these functions kind of fit in a classical Chinese medicine sense to a TCM sense. So if you're in first year Chinese medicine school, just learn it, how it's saying here. But if you're sort of more farther along in the journey and you're thinking, it's a little bit different to how we talk about these ideas of longevity, of life force, Ming Men fire, that kind of stuff. Cool. Okay, so and just as a disclaimer, this is not a replacement for medicine. This particular video is not really talking about conditions, treating them, that sort of stuff. It's talking about the theoretical understanding of how Chinese medicine works. And this video is for students of Chinese medicine, not patients wanting to get more information about their diagnosis. That's the other videos that I do are more based around that. So it's a little bit of a higher level. If you find yourself watching this, no worries. You can... No one's going to stop you from watching it, but just so you know where it's pitched at and what it's sort of for. So the main one thing to think about with the kidneys in this context is think about yin and yang. So it's all constantly mentioned kidney yin, kidney yang, and they're two concepts to kind of have a really good basic understanding of before you start doing the Zang Fu. Normally you would have that. So just to remind you and refresh you what's yin and yang, like you have the Tai Chi symbol. And those four main foundations that are talked about with the fundamental aspects of yin and yang are really important to remember. So like if you look at the Tai Chi symbol, that kind of reminds you. So each contains the seed of each other. That's the little dots, in the white yang with the dot contains the seed of yin. And think about it as day and night to start with. So day transforms into night and night transforms into yin. So each is inter-transformational, and that's what that means. So you can't have continuous day or continuous night. And even if you look into places like where, top of Russia area where you can have what they call white nights, which is like, long periods of day. Well, you equally have like long periods of night as well. Like darkness, so it's kind of equally balances out in some ways. It's just a little bit different in different aspects of the world. But in general, these kind of things are talked about. The original observers of this were in the continent of Asia and talking about looking at the observations of day and night in that way. Let's just go through some of these things from Giovanni. He said the main kidney function is that of storing essence and governing birth, growth, and reproduction. So that's a big one, right? So Jing is where you start to that's where Jing starts to be mentioned in talking about the kidneys or the essence. So Jing translates as essence. So I'm going to give you a couple analogies what's Jing to kind of help understand this. One of the analogies I give to students a lot is the 100 coins analogy. So if you had 100 coins and you wanted to know where all those coins are, if I gave you $100 in $1 coins, it's easier to keep track of that as a $100 note because you've just got one thing to look after and you know where it is, right? So that's kind of consolidated. Like, if you were a kid, you used to save up money in a big bag and take it to the bank or put it into that coin machine, and next thing you know, you've got, a lump sum, a large amount. And you think, wow, it actually seems like it's more than it was with all these, individually small amounts. And kidney essence is kind of a little bit like that, right? So if you had the savings to last you a lifetime, which was $100, and you separated it out into dollar coins, you're kind of using a little bit, each year, each day, that kind of thing to kind of live on. And there's some things in life that consume more essence or Jing than other things. And that's one of the things that in Chinese medicine we think about longevity. So if you're into the other branches of Chinese medicine like Qigong, Tai Chi, food therapies, those kinds of things, one of the underlying principles is about longevity and trying to keep our bodies healthy. One of those ways is to conserve Jing or save Jing and, look after our Jing, our essence. So back to this 100 coins analogy, one of the things that can happen with essence or with Jing is the kidneys are affected by shock and fright. And this someone jumping up behind you, like doing that kind of thing, and the people who are like that tend to have weaker kidney yang or essence, right? In a classical Chinese medicine sense, we tend to think of this stuff as yang rather than essence, and it's in a theoretical understanding of it, at this level, it's not so different. It's just a different way of saying it, different way of thinking about it. But when you get to the treatment of it, the way that it's treated in TCM and classical Chinese medicine, because you're thinking of it as yang and not essence, that's what makes it kind of different, I think, in looking at those understandings. I mean, I could be wrong. There's there's always room for error, but that's how I see it, thinking about the two different systems. So I've studied sort of both systems, and TCM, I've studied that for a long time, and also taught that for a long time, and that's one of the kind of clear main differences that I've seen since I've been doing a more classical system. So it's still good to understand these fundamental aspects like this, because it's the same idea that we're born with a certain amount of reserve, right? And so in TCM they say you have your prenatal essence and your postnatal essence. So what are those things? It sounds weird, right? Prenatal means before you were born, postnatal means after you're born. So prenatal is like the mummy and the daddy, the sperm and the egg, coming together and giving whatever they've got forms that prenatal essence. So some people know who their birth parents are. They know where their sperm and egg came from. Some people don't know that. And that's where you kind of have this mystery of, I could have genetic inheritance illnesses. Now, back in the Han Dynasty, when they were creating, when the Neijing was put together, they didn't have these concepts of genetics. They didn't know that. They didn't use that word, for instance, but they had this concept of inheritance, like you can inherit illnesses, because they must have observed that through history, seeing, okay, these people had illnesses and they've bred, especially in smaller communities like that, it would have been easier to see that because you didn't have as much you didn't have as much movement of people, and so you wouldn't have had as many unknown mothers and fathers kind of situations happening. And you certainly didn't have IVF and things like that, where you could have had some genetic material coming from another place that you didn't know. So they would have noticed those kinds of things just from observation, right? And so this idea that half of what you get when you're a baby comes from your parents. So if your parents are healthy, and that gives you the prenatal Jing. Now, the prenatal Jing comes from not just the parents, like the sperm and egg, but it's also it's helped along, or it's formed in that gestational period. So the 9 months that you're in the womb, or however long you're in there for. And so this is where premature babies kind of maybe get this, health problems, because they're not able to be developed properly. In a Chinese medicine sense, we would think of that as belonging to the prenatal essence. So that person might be born with a congenital abnormality, like if you don't gestate for long enough, your lungs don't mature, and so therefore you might have a congenital abnormality with your lungs. Now, in older times, before, premature babies can survive a lot longer than they could 20, 30, 50 years ago, right? And so because of modern medicine, because of drugs and all those kinds of availability of things. And so that means that person can survive. We don't know really what you have to look into research of premature babies and links to other lifelong illnesses or other history of what's the association between those things. But in Chinese medicine, that would be an essence issue. Now, one thing that's important to realize is okay, pragmatically, a patient comes to you and they said, well, I was a premature baby. We can't go back in time and do anything about that. But it sometimes can give us an understanding of, well, why does this person have this chronic problem that just won't go away? Why do they always get problems with their lungs, or why do they always get problems with, you know, their heart or something like that? Yeah, and I guess for me, I'm just a pragmatic person as well. There's no point in dwelling on stuff that you can't help, you know, to interrogate or question the patient about all those things if that's not, you have to ask yourself, how relevant is that in my diagnostic process and also my treatment process? Can I treat this? Can I help this? Now, something to think about might be for those patients is underlying that person might have a Jing deficiency. So therefore they have to either watch what they do later in life. If they can do a lot of things where we're going to talk about, you know, consuming the postnatal essence, then that could be something to consider, or herbs wise or acupuncture wise, they might need support in that area. So I think this video is just going to be about Jing and the kidneys in this Jing way, because it's going to be a long I can see it being a long night ahead of talking about this topic, and then I'll get on with the other things of the kidneys after. So so that's the prenatal essence, right? So prenatal essence comes from the quality of the sperm and the quality of the egg, the gestational situation. So if that mother had a lot of trauma or a lot of shock, emotional stuff is kind of mentioned. You know, there's mention of like nurturing the fetus throughout those 9 months, and the different things that the mother should think about. Like Chinese medicine's one of these systems that really encompasses the understanding, or the connections, interconnectedness of our mind and our body. And so those mental things that we do, those like the thoughts that we have, that affects our body. But if you're pregnant, it also affects the fetus and those kinds of things. So there's like longevity practices that are kind of linked to that. The other area where Jing and essence comes in greatly is when you're treating patients who want to conceive. They're having trouble conceiving, they're having difficulty having a baby, and so these are things where in a Chinese medicine sense, you can kind of look, the person wants to have a healthy baby, and if they haven't been able to conceive at all yet, that might be an indication that their essence, either partner's essence, isn't of the appropriate quality to be able to produce a good quality fetus. And that's something that when you go down that road, we're not going to talk about that in this video, but that's more something where you can really utilize modern technology and all testing and things like that are available to people to understand that, rather than just saying, oh, it must be a Jing deficiency, whereas people can actually go and have a sperm test. They can actually go and see, check their, you know, whether they ovulate and all those kinds of things, and there's lots of stuff to be done in that aspect. But in a Chinese medicine way, that's where it kind of fits. Okay, so we talked about prenatal essence. Now, what about postnatal essence? So this is like the top up of the essence, right? So let's say there's nothing you can do about that prenatal essence except not waste it, okay? So that would be the coins in the bank, right? Let's say you're born with 100 coins, and that's what you've got. And so do you use that prenatal essence for much in life? Do you use it for a lot of things in life? And when might you use it more? So you make and this is another argument, an argumentative thing in Chinese medicine. Can you produce prenatal essence? Can a person make more prenatal essence? So we'll just talk about that a little bit in this video. But it's a bone of contention, let's just say, in Chinese medicine. So in order to produce postnatal essence, it's like a surplus of the digestive processes, and so you'd have to have a body, one, that's healthy, that's not draining the resource. So the Jing is the resource, right? It's the battery pack, if you like, of your body, or the money in the bank, the 100 coins in the bank. And so let's say it costs you $1 per year to live, right? So you've got 100 coins in the bank, you've got 100 years, and it costs you $1 to live. No matter what you do, you have to take that dollar out, right? And if you get a job and you do some other things, then you can have a pretty good life and enjoy yourself if you make some more money with other things. But if in some years you don't make much money, or you have a lot of stress, and for some reason you have to spend more money, or you decide you want to buy a lot of things that are excessive, like alcohol or drugs or things like that, that costs you more money. You have to draw that out of the Jing bank, let's say. And so then that lessens your lifespan. And that's kind of how, it's one analogy of thinking about how essence is used. So that would be using up your prenatal essence. But at the same time, if you're in a position where you're consuming the prenatal essence, you're not producing any postnatal essence, because if you were, you wouldn't be using up the prenatal essence. Now, how can we tell if people are using up their prenatal essence, right? There's no Jingometer like that we can see. There's no test you can do for people, apart from these kind of checks that we do in Chinese medicine, where we would be looking at your pulse diagnosis. So that's a really good indication for a practitioner to be able to kind of feel on their pulse between the left and the right hand, and then looking at, like in TCM, they look at the kidney positions, which is the last position, this kind of the lower one. It's hard for me to show you one here. So this is like the Sun, Guan, and the Chur positions, like the lowest one. And your pulse naturally sort of goes down, goes lower. But for some patients, like the force of the pulse, let's say, it's hard for me to do these videos without getting onto too many tangents and getting off topic. But the force of the pulse is the stomach chi, right? So if there isn't any stomach chi, then there's probably not much Jing, because or your body's consuming that Jing because it doesn't even have the stomach chi to kind of give the pulse the force, right? So that's one way of thinking of it. So how do you make postnatal essence? Through breathing and through diet. And that's why your earth element's so important, your digestive system, to make sure that that's important. And in in Western medicine and naturopathy, they talk about gut health, your gut-brain connection, all that sort of stuff. And that's where it comes into it, because you can only get nutrients, you can only absorb nutrients through a healthy digestive system. So you might be eating the right foods, but you can't absorb all those nutrients, or you might be bombarding and overloading your body with so much stuff to do. And that's where Jing depletion kind of comes in as well. Now, there's a few things also that deplete Jing, like activities that deplete Jing. One is too much sex, and one is too much like overexcitement in that way, like emotional, like excessive joy that damages the heart and like sort of makes people like, overexcited, and that can kind of in time damage. So and then again, any prolonged illness or prolonged situation where a person's in a state of anger all the time or in a state of sadness all the time, eventually any of those things can cause a Jing deficiency. So if you're on a TCM paper and you're looking for an answer, like almost Jing deficiency could be part of something in these really chronic illnesses that kind of just hard to get rid of, never go away, that kind of stuff, like conditions, not so much, not like a cold or a flu, but a person that like, has all these kind of health, all these chronic health problems, can often be attributed to, or Jing deficiency can kind of be part of that. Now, one of the things that I find as a useful analogy or an example of Jing deficiency is thinking of the use of drugs that really depletes a person's Jing. Now, in Australia, we have a drug called methamphetamine, and I'm sure you have it in your country too, where you're from. But there's when you see someone who's on meth, they will usually get very, very aged very quickly. And so one of the things that Jing is responsible for is the vitality of our body. So it's providing the vitality for your mind, your Shen, your consciousness, but also your skin, like you're producing blood and nourishing your skin, and providing the vitality to produce a good immune system, sort of the underlying little extra battery pack, I guess, that's there. So if a person goes and uses a lot of drugs, there's a couple of things that happen. One is the concept of getting high. So it produces that excessive joy or euphoria, and being in that state chemically, let's say, and for a prolonged period of time, really damages your yang. It uses up too much Jing or yang, kidney yang, or Jing, however you want to put it. And what it does is it kind of, how you get that high is it uses that essence, uses a larger amount of essence in a shorter amount of time. So it's like saying, here's a check to go to your Jing bank and get 10 coins out, and that's 10 years. You should really be using that over 2 or 3 years or 10 years or whatever it is, and you get this thing and you just use it. And then you see people after a few months of being on certain drugs, heroin's another one, anything where people get really whacked out high. I mean, to a lesser extent, other drugs can do that as well. Now, there's a really good author, he's an Australian guy called Josh Sawyer, and he wrote a book called Higher and Higher, and I think he just wrote another book, excuse me that I don't know the name of the book, but he did just write another book. But he's a really well-known author in this area, and so if that's something you're interested in knowing about drug use in Chinese medicine, or just addiction, like helping patients with addiction and things like that, his book is a good place to start kind of learning about that. So that's Josh Sawyer. I'll put the details, I'll put the link I'll put his name in the description below, and you can look on Amazon or wherever you go for your books. But that is a concept where that's a thing that's happening where if you're using drugs, the more high you get, the more euphoric you get, certainly the more essence you use, right? And the more things that you can do unnaturally. So there's some drugs where you take and like speed, and you're just like, able to do a lot of stuff, and like ADHD medications, sometimes that has that opposite effect if people don't need that, where they are just excited and energized, right? Where's that energy coming from? Well, we think about coming from your Jing bank, coming from your essence, and using that. So drugs that reduce pain or have a depressive, relaxing function also can deplete Jing as well. That's probably more from an effect of, okay, some of those things can have a euphoric, a high effect, but some of those things also, just because they're so hard to digest, they tax your organs. So they tax your liver and your kidneys. And how do we know that? Well, if you overdose on those things, you'll need a new liver and a new kidney, or either of those things, because there's a certain capacity where your body can't, digest it, reaches the maximum capacity it can digest of those things. So that brings me to this point of how do we conserve our essence? How do we keep it from, being overused? Let's say you're not a drug user and you just think, Maria, I just want to conserve my essence, or tell my patients how to do that. So by eating healthy meals, by eating regular meals, by not overtaxing yourself, by having regular sleep, and regular, I've mentioned that a few times because it's really important. Like, your body likes that regularity. It keeps it in tune with that yin and yang kind of cycle. And that stuff is good. Allowing yourself to have enough rest when you need rest, right? So you're not sort of sleeping too much. And sometimes that need of sleeping can be part of the kidney. We're talking about the kidneys today as, part of this Jing topic. Can be part of that deficiency. Something to note, if you're new to Chinese medicine as well, is you don't just wake up with a Jing deficiency. You don't just suddenly get one, right? Usually that person would have had other health problems going on first, and they would have had some functional stuff going on before. This is more like a material change. It's more like something that repeated illnesses have happened, or repeated health problems, or they haven't been able to kind of do get a result with the other things they've used. And it's this person might be chronically tired, or they have to pace themselves, that kind of thing. They'll use that kind of language. Oh, I can't, they might be only able to work part-time, or if they're around too many people, it sort of drains them, or they've got to have sleeps in a day, or stuff like that. Or they just struggle with a lot of pain or a lot of illness constantly, that kind of thing. So kidney essence, that's one thing. So healthy kidney essence or abundant essence means you don't age as quickly as someone with less essence, right? So if you want to think about anti-aging, it's essence that you really, if you could bottle essence, I wouldn't be making this YouTube channel, I'd be a millionaire, because that would be the fountain of youth, right? The essence. So unfortunately, in one way, the way you keep your essence healthy and you don't use it is don't have that extravagant lifestyle. You can't have it both ways. You can't be out taking drugs and partying and not having enough sleep and, that kind of lifestyle and expect, to look good for that lifestyle. And I think we've kind of, in our society, we've kind of come a full 360 in that way. Like in the 80s, it was really a popular thing for people to do a lot of cocaine and work really long hours. And, you know, that was kind of seen as like, oh, you're a productive person and you're a party person. And, you know, you're living the high life. Whereas now people are more aware of, hey, you need your 8 hours sleep. And there's nothing wrong with saying that you need that 8 hours of sleep. There's nothing wrong with having that sleep and having a healthy lifestyle to do that. So you can still be productive and busy, but sleep is super important and your food is important. So if you're not sure about the food to eat or to advise your patients to have, go back and look at the spleen one or the video I made called Why Eat Mostly Cooked Foods, and that kind of explains the crux of that. That's the most popular video on this channel. It's a little bit old. The audio is not the greatest because I didn't have all this equipment when I first did that video, but that would be the first thing to think about with essence. So excessive sexual activity, let's talk about that. That's mentioned in Giovanni as well. And he says, this is modestly referred to in Chinese books as unregulated affairs of the bedroom or excessive labours of the bedroom. Traditionally, the idea that excessive sexual activity can weaken the kidneys is very old and can be found in the Yellow Emperor's Classic. Gives a little reference for that somewhere. Anyway, so he says, as mentioned in the chapter Causes of Disease, excessive sexual activity weakens the kidney energy because sexual energy is a manifestation of kidney essence. So there's a few things here to think about. It's got to do with that joy and euphoria. So if you are masturbating, it's the same kind of thing as having sex, especially for a man. One is because you're losing the actual, like your ejaculate, and that is actually essence. So you're losing, your sperm. So you're consuming more of that. You know, there's different kinds of practices, sage-like practices that in China, like, are linked to Chinese medicine and to try to keep the essence in, like not masturbating, basically refraining from all sexual activity, and refraining from getting aroused and that kind of stuff, so that you're keeping all that energy, that sexual energy in, and that's kind of making you stronger in terms of making your Jing stronger. That's one thing. I think like excessive sexual activity has a more detrimental effect for men, whereas too many babies too close together, including miscarriages and that kind of stuff, is more detrimental for women from that essence perspective. And another thing to mention, because we're living in a modern society, is like IVF procedures, and that IVF process can be super duper taxing to people's Jing, their essence. One is because it's emotionally taxing. There's this up and down roller coaster, and plus they're pumping you with more hormones than you normally would have, so that you can produce the eggs, to get the eggs collected and all that kind of stuff. And so that can be emotionally taxing. It taxes the person's relationship. There can be emotional tension in that way. Some women find they get hot flushes, they get, like lots of symptoms happening, their cycle gets irregular, that kind of stuff. And so that's something to consider for women who are going through that. They probably need to go through IVF if their Jing is so depleted they can't conceive naturally. But then the IVF process depletes their Jing. It's a kind of a catch-22 situation. So that's something you can do. You can try to support those women with herbs and acupuncture through that process if possible, using that concept of supporting their Jing or tonifying their Jing. Yeah, so one of the things with Jing is the connection with your heart and your mind, so that overjoy and that euphoria. So when you are aroused, or when you have an orgasm, that arousal and that orgasmic nature is sometimes what's depleting the Jing as well. So that's where like excessive thoughts, or someone that's obsessed with sex and sexual thoughts and things like that, and needing to be aroused all the time and that kind of stuff, can deplete their Jing. And like treating this stuff is much more complicated, and it's not as simplistic as what I'm just saying now. So you need to go through all the diagnostic processes that you normally would with your diagnosis. And this is something you probably think about this in 4th year Chinese medicine, like how does this work out in pathology? A patient comes in and says, I have excessive thoughts about Like I can't stop thinking about masturbating. I can't stop thinking about, you know, a partner or a person or, you know, people or whatever. Who it might be a person that they're obsessed about, or it might be just sex that they're obsessed about. And this can have sort of a multifaceted approach where it's creating this euphoria, but then they also feel like really depressed or sad or, you know, other emotions or stuff, and, you know, that kind of stuff. So yeah, I hope this has been useful and helpful to you to kind of start to understand the water element, kidney, and we're talking about Jing essence. So we've talked about prenatal essence and postnatal essence. And then the next half of the video, we're going to talk about the other functions of the kidney and how that relates. Some of that will relate back to essence. And so hopefully you've found some use from this video, and tell your friends about this if you've got friends that are studying Chinese medicine. This series is called Chinese Medicine Study Buddy. And if you've got suggestions for the next part of the series, we're going to be finishing up the Zang Fu real quickly. Well, it's just been the Zang mostly. We could do the Fu organs next, or we could do some other things. Someone's asked for some stuff about channels and acupuncture points. If you've got a suggestion of something you'd like to talk about, then put that in the comments below. Make sure you subscribe to the channel, and I'll see you again on the next video.